Hi, Northern Michigan, it's Rebecca back here at Munson Medical Center for Munson Minutes. And I'm so excited because today I'm joining Dr. Christine Nefcy. Not only is she one of our top medical experts here at Munson Healthcare, she's also a pediatrician and a mother. So thank you so much for being here with me, Dr. Nefcy.
Thanks for having me.
So Dr. Nefcy, I have 2 young children. And so, when COVID started, it really seemed to be affecting mostly kind of older individuals, and I wasn't really worried about my kids. But now it seems that it's affecting kids more. Can you kind of talk about that? Because it's really top of my mind.
As a pediatrician and mother myself, I can certainly share your concern. I think what we saw with this latest surge is definitely an increase in the number of children and young people that were infected with COVID-19. We chalk that up to a couple of things. First would be the success of the vaccination program in our older population. We combine that with some reopening and the start of high school athletics, and then the variants. And I'd say the variants probably are top of mind. They are much more contagious than the original form of the virus. And so we absolutely saw an increase in the number of children and young adults that got infected with COVID-19.
Right now with the vaccines, I know that they're approved for 16 and up, but I heard that it's going to be dropping to probably 12. And so what does that really mean? And what can you kind of tell us about that whole change?
Yeah, that's exactly right. We did hear the FDA did approve Pfizer's emergency use authorization to vaccinate down to the age of 12. I think it's important to note that the studies that have been done show great efficacy and safety in that age group.
That's great, but my kids are younger than 12. So what should I be looking for and what should I do to help protect them even more?
So really the way to protect our younger children and other vulnerable members of our community are for more people to get vaccinated and then to follow the same mitigation factors that we have followed all along. So wearing a mask, washing your hands frequently, good hygiene, staying cocooned within those people that are safe. And as we head into the summer months, we know that getting together outside is a much safer option than getting together inside.
Thanks, Dr. Nefcy. That's really helpful. And, certainly we've been doing a lot of those mitigation factors, but I've also been reading about the MISC, I think it's called. So can you tell me about what that is? Because it has me really worried.
Yeah, so MISC is Multisystem Inflammatory Syndrome in children. And what we know so far is that it's a complication from COVID. We are seeing certainly an increased number of cases of that as we see more children hospitalized. And I want to be sure that people understand that's not the only complication that requires children to be hospitalized with COVID-19, but it is a rare and very serious complication. What happens is that there is a abnormal inflammatory response in any really organ system, and an inflammatory process happens and children get very, very sick.
Say my child does contract COVID-19, and what symptoms or what signs should I be looking for this MISC?
You should be looking for fever. We talked a little bit about the different systems, so it could present as a rash. It could present as pretty significant abdominal pain with or without vomiting and diarrhea. It could be neurologic symptoms like a bad headache or even slurred words. Anything respiratory, so especially if your child appears to have difficulty breathing, all of those things would be very concerning, and we would absolutely recommend that you see your pediatrician or family medicine provider, or if it seems urgent or emergent, go to the appropriate level of care in an emergency room or urgent care clinic.
So, Dr. Nefcy, what should parents do if they have more questions about any of these topics that we've talked about?
Yeah, questions about your child, their symptoms, or whether you should get your child immunized. We always would encourage you to talk to your pediatrician or family medicine physician. If you don't have a primary care provider or you have further questions, our Ask a Nurse line is also always available. They are available 7 to 11, 7 days a week. And you can just call that number and speak to a professional, and they will guide you through any questions that you may have.
Thanks, Dr. Nefcy. It was really great being here with you today. That was great information. And again, Munson Minutes, you can visit our website anytime, or the Ask a Nurse line is also a great point for you to be aware of, that you can ask your questions at times that are convenient for you. So again, thanks for joining us, and we'll see you next time, Munson Minutes.